morning, students. In the series of anterior triangle subdivision, this is an important subdivision of anterior triangle called as the carotid triangle. The question is describe the boundaries, contents and applied anatomy of the carotid triangle. Okay, though it is a short question, okay, not very lengthy, but it is quite important. Okay, let us see the boundaries of the carotid triangle. Now in this diagram I have shown you the boundaries of the diagram where I will show you the boundaries of the carotid triangle. Most of the muscle I have already colored here. Let us see, this is the superior part, this is the anteroinferior, okay, and this is the posterior part. So the triangle is here. See this area where I am just tracing the pencil, this is the triangle. This is the hide bone, the greater carnoa of the hide bone. This is the thyroid cartilage. This is the cricoid cartilage, okay, and this bluish color structure is thyroid membrane. This is called as thyro, which extend from the thyroid cartilage upper margin to that of the lower margin, okay, not lower, upper margin of that of the hide bone and to that of the body of the hide bone and to the greater carnoa of the hide bone. Okay, now this is that fibrous sling through which passes the intermediate tendon of the digastric muscle. This is the posterior belly of the digastric going here to attached deep to that of the mastoid. So this is the site where you will get the mastoid process. So this is the posterior belly of digastric. See this is the posterior, I will write in short, belly of digastric. Okay, just this is the posterior belly of the digastric, and this forms the superior boundary of the carotid triangle. Okay, and just above the posterior belly of the digastric, running along with this posterior belly, taking origin from the styloid process, is another cylindrical muscle which will come and get attached to the hide bone here, is called as stylohyoid muscle. I have not drawn this just to keep the whole diagram clear. I have not drawn many things on this. So this is the stylohyoid muscle and the posterior belly of the digastric, which will form the superior boundary of the carotid triangle. Please keep on noting in your notebook. Then anteroinferiorly, this carotid triangle is bounded by the superior belly of the omohyoid. This is the superior belly of the omohyoid which is going anteroinferiorly and forming. So this is the superior boundary and this is the anteroinferior, okay, anteroinferior. Sometimes this posterior belly is said to be formed anterosuperior boundary. So anyway, you may call it as anterosuperior or just superior. This is the anteroinferior, okay, by the superior belly of the omohyoid. Let us see the third boundary of this carotid triangle, and this is called as the posterior boundary. And this posterior boundary is formed by the anterior margin of the sternocleidomastoid muscle, which overlaps the superior belly as well as to that of the posterior belly of the digastric, superior belly of omohyoid. So it covers both, okay, when they meet. Okay, so this is the anterior margin or anterior border of the sternomastoid muscle. Thus you have seen the borders of the carotid triangle. Just draw a very simple diagram, line diagram only, okay. The floor we are seeing. Okay, I have not drawn the structure on the floor which I am going to draw just now. Okay, so as you can see the floor. What is the floor? Most anteriorly in the floor, just above the greater carnoa of the hide bone, you will see a muscle taking origin and going upwards towards the tongue. This is the hyoglossus muscle. So this muscle, a small part here is seen, is the hyoglossus muscle, okay, muscle of the tongue. hence called as the hyoglossus muscle. Then there is an membrane below this, that is the thyroid membrane. This blue color structure, thyroid membrane, is taking origin from the upper margin of the thyroid cartilage, laminar on right and left side, and here attached onto the hyoid bone. Now this thyroid membrane here is showing the two foraminas. Okay, these two foraminas, they are for the openings of the internal laryngeal nerve. I will just give the name it here as internal laryngeal nerve, which is a branch from superior laryngeal of the vagus. Okay, and it is going inside to supply the muscles of the larynx. So it is internal laryngeal nerve, and this vessel which I have shown here going into this opening into the thyroid membrane is called as, here we will call this as the superior laryngeal vessel, because vein will also go. Superior laryngeal vessel, they will penetrate, okay, and will go into the larynx here, okay. And this blue color structure I said is a membrane through which this thyroid cartilage is hanging, or the larynx is hanging to the hyoid, and this is called as the thyroid membrane. It is a membrane, fibrous membrane, thyroid membrane. Okay, so these structures, they are forming the floor. Okay, hyoglossus muscle, thyroid membrane, and then comes the inferior and the middle constrictor of pharynx. This one here, which is attached to the tip of the this greater carnua, this is called as the, I will just name it here as the middle constrictor of the pharynx. Middle constrictor of pharynx. So it will form the pharyngeal wall, and this is the, this muscle is the, let me draw it here, I mean to label it here, inferior constrictor of pharynx. So inferior constrictor of pharynx. So these are two constrictor are muscles of the pharynx, middle constrictor, and these all structures they form. In the anterior between the superior and anterior antero-inferior border, you may get a small portion of this muscle which is extending from hyoid bone to the oblique line of the thyroid cartilage and hidden deep to the superior belly of omohyoid. I hope you can see. Okay, this much small part here, and this is called as thyroid muscle. Thyroid, because extending between thyroid cartilage and hyoid bone. So this is a muscle, thyroid. And this is the thyroid muscle. The other muscles, they are there, but they will not come into the carotid triangles. Okay, they will remain into the muscular triangle. For example, sternohyoid and sternothyroid. Okay, they are away from the carotid triangle. That's why I am not talking about that. So I hope that the floor of the carotid triangle is complete. Okay, in this diagram I have pushed the sternocleidomastoid little laterally so as to I'm sorry so as to expose a wider area of the otherwise carotid triangle is not that wide. Okay, just to show the various structures which are at the floor and then at the content. Now let us, before coming to the contents, let us see the what is the roof. Roof is naturally on the lateral side of the neck. It will be the skin of the neck, then superficial fascia, the fibrofatty tissue of superficial fascia deep to the skin, and in this region we have already seen that they contain a platysma muscle, which is the subcutaneous muscle. Okay, subcutaneous muscle running in the superficial fascia in fibrofatty tissue, and there are the cutaneous nerves are there, transverse cervical nerve branches are there, and then maybe some branches from the great auricular nerve, and then you may also see a nerve coming from above, that is the facial, I mean to say cervical branch of the facial nerve, which will supply to the platysma muscle. Okay, after this superficial fascia at a deeper level, the whole thing is covered by the general investing layer of the deep fascia. So then the ultimately deepest part of the roof is the deep cervical fascia. I hope that you have understood the boundaries, floor and the roof. Let us come to see the contents. Okay, if we go to the contents of the carotid sheath, then you should note that the carotid, not carotid sheath, in the carotid triangle, then you should note that the structures which are very important structures like the internal jugular vein, the common carotid artery, internal carotid artery, vagus nerve, and deep to which, posterior to which lying the sympathetic chain. Okay, of course, sympathetic chain is not within the carotid sheath, but the other structure are within the carotid. They cannot be seen. Okay, they are completely invested, except the external carotid artery and its branches can be seen. So most of the structures on carotid sheath, and in this diagram I will tell you that after removal of the carotid sheath we are looking the contents. Okay, so don't think that carotid sheath is not there, it has disappeared. It was there, but we have removed. Let us come to the first important content, and it is the internal jugular vein. Okay, internal, which lies beneath the anterior margin of the sternocleidomastoid. Okay, beneath the. So I will just draw the, and as I said that we have pulled the margin of the sternocleidomastoid backward so as to completely expose this internal jugular vein, which is running in most posterior most part. So I have just very roughly drawn this internal jugular vein. Okay, so this is the intern, which otherwise is under the carotid sheath, within the carotid sheath. Okay, then in front of this internal jugular vein will lie from in the lower half part common carotid artery. Okay, so this is the common carotid artery, and as you have learned that the common carotid artery will divide into external and internal carotid artery at the level of the upper border of the thyroid cartilage. So this is that thyroid cartilage, upper border of the thyroid cartilage, where it will divide into internal and external carotid artery. Now this internal carotid artery, what it will do, it seems to be continuation of the common carotid artery, and straight it will go towards the upper border of the triangle. That means it will disappear deep to the this posterior belly of the digastric. So this is the internal carotid artery. But then from its anterior aspect will come out a artery, and this is the terminal branch of the internal carotid artery, which is called as the external carotid. So this is internal, just note down, let me also note down. This is the internal carotid artery, and this is the external carotid artery. So internal and external carotid artery are the contents of the upper part of the carotid triangle. Okay, upper part of the carotid triangle. Okay, now from this external carotid artery many branches will come out, and in the last video I have shown you that the branches of the internal, I am not going to draw it here many because it will complicate the diagram. So this artery gives the first branch, the ascending pharyngeal artery, which takes origin from its deeper aspect, then from anterior margin the superior thyroid. Just let me draw, there is a space and I will draw the superior thyroid, which will come towards the thyroid gland, will go deeper and will come to the thyroid gland. Okay, so this is the superior thyroid artery, ascending pharyngeal. Then it will be having a loop like lingual artery. okay, which is close to that, the greater carnua, okay, just I have drawn it little lower down, okay, so sorry for that. And then there will be an artery which will be going to the face, that is the facial artery. There will be an artery which is the occipital artery, okay. So these are the arteries which will take origin from the external carotid artery. Occipital, then the lingual, and above the lingual is the facial, disappearing deep to the this posterior belly of the omohyoid, and then you have seen the superior thyroid and the ascending pharyngeal artery, which is not seen, okay, because it lies behind, but it goes right up to the base of the skull. So these are the branches which are given in the carotid triangle. The other branch is the posterior auricular, which is not given in the carotid. It will be given at the upper border of the posterior belly of the digastric. Okay, so these are the vessels, that is the internal jugular vein and the common carotid, external carotid and internal carotid branches, terminal branches of the internal common carotid, okay, common carotid, and they are lying on the floor, okay, as you have seen. Then there will be a nerve, okay, let us draw some of the nerve, and in the sum of the nerve we will see that there will be a nerve which is going quite superiorly, okay, crossing to the vein from superior angle, and this nerve is I'm using the yellow color which may not be seen, okay, just I will use the black color now, okay, and in between we'll try to fill the yellow color so it becomes visible. This is called as the accessory nerve, spinal accessory, which is going deep to the sternocleidomastoid, will come to the posterior triangle and then will disappear deep to the trapezius muscle in the posterior and the posterior margin of the this, because this area is nothing, just what lies posterior to the sternocleidomastoid. Here is the posterior triangle, okay, here is the posterior, so this is going towards the posterior triangle, spinal accessory nerve. Then another important nerve is here, which will come out and will go towards the hyoglossus muscle, where this hyoglossus muscle is present. It will go there, but it will come out from the upper part, and let me again draw with the black pencil, otherwise it will not be seen. And this nerve which will just curve like this, okay, this curve, this is getting more complicated diagram, so this now, okay, in the black I have drawn and will try to give the color. It will go superficial to these vessels, okay, and since it is the 12th cranial nerve, hypoglossal, this is the 12th cranial nerve which is going towards the tongue, going. So this is the hypoglossal nerve. Let me write hypoglossal nerve, okay, that is the 12th cranial nerve. So I have written 12 in this Romans, okay, 12th cranial nerve will also be here. But the important nerve which is going between, in the carotid sheath, between the common carotid artery and internal jugular vein, and in the upper part between the internal carotid and that of the internal jugular vein, coming throughout its course in the carotid triangle. This is there, and this nerve is called as the vagus nerve, and it lies in the carotid sheath and between the vein and artery. Okay, I hope you can see this yellow thing. This is the vagus nerve. So the vagus nerve is another important, contents, okay. So accessory nerve, hypoglossal nerve, the vagus nerve, and then there is a ansa subclavia. What is ansa subclavia? It lies onto the internal carotid artery, then it lies partly onto the common carotid and forms a loop here, and these nerves of the loop are deep to the sternocleidomastoid muscle, and this is called as a loop of the ansa, which takes origin from this hypoglossal nerve. So when the hypoglossal nerve is just crossing to that of the internal carotid artery, it will give a branch which will run on the surface, and then it will go down, I mean say backward to form a loop. That's why it is called as ansa. Ansa means loop. Okay, I am sorry. Well, I was telling you that the ansa cervicalis supplies the muscles of the muscular triangles and other muscles. Okay, so this is the ansa cervicalis. Let us go to another important contents of this carotid triangle, and it is the deep cervical group of the lymph node. Now these lymph nodes are very important, and they are located at upper and the lower angles where the internal jugular vein is passing. Now here they are in relation to the posterior belly of digastric, where it is crossing to that of the internal jugular vein. This is the area, or deep to the digastric belly. There are the deep cervical group of lymph nodes, and these are called as the jugulo-digastric, internal jugular vein and digastric muscle, hence jugulo-digastric. Similarly, near the lower angle here, where vein is crossed by that of the superior belly of the omohyoid, and this is called as the jugulo-omohyoid. All these are the large group of lymph node, and they are classified as the deep cervical lymph node. And these lymph nodes, they are just resting on the surface of that of the internal jugular vein. And another important contents in this triangle, carotid triangle, is that which I have not shown because it is very deeply situated. Deep to this carotid sheath is the sympathetic chain. The cervical part of the sympathetic chain is just embedded on the posterior surface of that of the carotid sheath. I hope that this completes all the contents of the carotid sheath, and let us now go in the last point of this video lecture is called as the applied anatomy. And applied anatomy is in relation to that of the enlargement of this jugulo-digastric and jugulo-omohyoid lymph node, which are deeply situated in the cancer of the surrounding area to which these lymph nodes are draining mostly from the oral cavity. Okay, and the surrounding area, this lymph node will get enlarged. Okay, and if it is quite delayed, okay, this spread of the cancer is, if it is delayed, then this lymph node will join each other. What is called as the matting of the lymph node, and then this lymph node will also started, fusing with the wall of this vein where they are located. And once this lymph node will start infiltrating to the wall of the internal jugular vein, it will be difficult to remove them, because in surgery one has not only to remove the site of the cancer but also to all those lymph nodes which are draining to that area of the cancer. So it will become difficult, very difficult to operate, okay, because then you will have either to cut the vein, or then it will be real difficulty will be, and it may become where surgery will not be possible. Surgery will not be. Another applied importance may be in relation to the carotid sinus and carotid sheath. Carotid sinus. Okay, carotid sinus. Okay, and this carotid sinus and these structures which are baroreceptors here into this, okay, and they are chemoreceptors also. Okay, sometimes the tachycardia of the heart, tachycardia means increase rate, okay, can be by the compression of this carotid sinus. Okay, that can be controlled. Thank you very much for watching this short video on the carotid triangle. Okay.